you are basically measuring the tension. So what are the various things? This is the total tension, this is the active tension, and this is the passive tension. So basically in the length tension relationship curve, what is in the active tension? It is that tension which is being generated by the contractile elements of the muscle whenever the muscle is stimulated electrically, is what you need to basically remember. Whereas passive tension is being created by the elastic force which is acting on the muscle whenever the muscle is stretched. So this is what you need to be very, very clear about. Now the second question is all about the neurotransmission. Basically, what is that very important ion which is involved at the neuromuscular junction? Whenever the acetylcholine binds, the movement of the sodium ion is the one which brings the depolarization, is what you need to remember. That's the reason it is the sodium ion and ultimately when sodium ion stimulates, there is a release of the calcium ion from the sarcoplasmic reticulum. So the ion B is calcium, is what I want to reinstate. Ditto, same question will come tomorrow when you go for the MD entrance exam. This is a very common way of asking. If you look at the left ventricular pressure curve, there is a systole, there is a diastole. During systole, what happens to the left ventricular pressure? It contracts. That's the reason it increases. And during systole, it loses the blood into aorta. That is the reason it will start falling down and the pressure ultimately falls down. So this is the point which you need to appreciate, where the mitral valve closes, aortic valve opens and the pressure rises and the systole is actively happening. Between the closure of the mitral valve and this point where aortic valve opens, what is responsible for the rise of the pressure, doctor? A very important question. I'll tell you. Now, whenever the mitral valve closes, before the opening of the aortic valve, what will left ventricle will do? It will undergo isovolumic contraction. During that time, mitral valve is closed, aortic valve is also closed. When both the valves are closed, it is undergoing contraction, that will cause a rise of the pressure which is sufficient enough to cause the aortic valve opening. After the aortic valve opens also, it will rise a little bit high because contraction is continuing, but that empties the blood into the root of aorta, and that is the reason the pressure will basically fall down. So once the pressure falls down, what happens? There is a closure of aortic valve, and that is the reason there is a point at which the aortic valve closes. Once the aortic valve closed, that time mitral valve also is in a closed state. Already blood has filled into the aorta. Then what will it undergo? It will undergo relaxation. Because of that, there is a fall in the pressure. Then there is a point at which mitral valve opens and the blood flows into it, and that once more slowly raises the pressure. So this is how systole, diastole keep going on, is what you have to appreciate. Commonly asked MCQ in entrance exam is examiner loves to know whether you know that this is the point of opening of mitral valve, closure of mitral valve, opening of aortic valve closure, then the mitral valve opening in the pressure curve of the left ventricular pressure curve. And to this you must correlate the auscultatory events S1 and S2. When will S1 occur? Obviously whenever the mitral valve closes. Whenever the aortic valve closes, that is the point where S2 will occur. So this is what you need to understand. Now a word on fetal circulation. Where is the highest amount of the oxygen saturation, doctor? Umbilical vein. So where is the umbilical vein? Typically umbilical vein is originating here. So that is the reason you have the highest amount of oxygen saturation, almost to the point of 85% is the oxygen saturation in the umbilical vein. Now the heart has pumped the blood into the aorta, and whenever systole, diastole are happening, there will be spikes of pressure changes that keep happening, and until where you can feel those pressure pulsations in the aorta, arteries and arterioles. Wherever the blood is passing through the capillaries, drastically the pressure will fall down, and ultimately the veins and vena cava, because they are dilated, distensible, compliant, they will accommodate the blood without any rise of pressure. That is what you need to appreciate. Now this is a simple action potential curve of the myocardial pacemaker cell. So what is the cause for this zero phase? Why a pacemaker cell is automatically pacing without any stimulation coming and stimulating it is very important part of the physiology which you need to appreciate. So the phase 0, the spike which occur in the pacemaker cell, is because of the movement of the calcium influx to the long acting calcium channel. Then you have got the phase 4, phase 3, etc. I leave the literature for you. So pacemaker potential is a favorite topic. Now this is the positive inotropic and negative inotropic effect. On y-axis, if you have stroke volume, what will you expect to have on x-axis? It is also called Starling's principle. So basically, right atrial pressure and end diastolic volume. The more the heart fills and get more stretched, the more will be the contractility and cardiac output, said the Starling. So end diastolic volume, the more it is, the more it will cause the cardiac output to come by increasing the inotropic state. That's the reason on x-axis end diastolic volume on right atrial pressure is what you will basically guess. Now you have 3 different types of cardiac cycles. 3 different types of cardiac cycles. Everywhere this blue line is what? Normal cycle, and there is an effect of either afterload increase, preload increase, or inotropic state increase. So which one corresponds to what? This is a state of increased preload. This is whenever you increase the afterload, the pressure at which the aortic valve closes, na, or the rise of the left ventricular pressure, na, it will be higher whenever you increase the afterload. Then this is the effect of increased contractility. Whenever the contractility increases, all the events become preponed. What are the events? Opening of the mitral valve, closure of the mitral valve, aortic valve, everything will prepone. So that is the difference. Now, what is the effect of hand grip exercise? Hand grip will release catecholamines. Released catecholamines lead to development of increased afterload predominantly. That's the reason the predominant effect of hand grip exercise is what? Increasing the afterload. What is the predominant effect of squatting? Squatting will increase venous return and preload. Standing will decrease preload. Squatting will increase preload, but squatting will also cause increase in afterload. Both the preload and afterload are increased by squatting. That is what you need to understand. Then in the spirometry, the various values you must be quite sure, doctor. So the tidal volume, residual volume, etc., I think you are quite sure. We asked about functional residual capacity. If you combine expiratory reserve volume and residual volume, the two constitutes the functional residual capacity. Whenever two volumes are combined, you get one capacity. Okay? Then, doctor, you have a lung, two scenarios. If you take the relation between the lung volume and the pleural pressure. In this scenario, what is happening? Even at a higher pleural pressure, the amount of lung volume achieved is lesser. Whereas here, just like a balloon, with little pleural pressure only, lung volume achieved is higher and the lungs are getting hyperinflated. This is a scenario of obstructive lung disease and this is a scenario of restrictive lung disease. That's the reason fibrosis will lead to the curve B is what you need to basically understand. Curve B is what you should appreciate. Tomorrow Sunday full scale grant test, I am not going anywhere. 9 to 12 you take the test, 12 to 2 we will have discussion. I think afternoon we have a pediatrics class after the discussion is over, post lunch. So every question paper we will have 25-30 slowly, around 30-35 questions image based, which is in accordance with the new trend of the examiner. Now doctors, you have a hemoglobin, two kinds, scenarios are there. We are talking about the oxygen content on the y-axis. In spite of achieving 100% saturation, what is the main difference between these two hemoglobins? The content of the oxygen is lesser than the other hemoglobin, other scenario, other patient. If you take a anemic individual, he has a lower hemoglobin than the normal person, but that is a normal hemoglobin. capable of achieving 100% saturation. But because the total content of the hemoglobin being low, it is only 8 grams, other guy is having 13. Content of the hemoglobin being low, though it achieved 100% saturation like the normal guy, a 8 gram hemoglobin guy versus 13 gram hemoglobin guy, both will achieve 100% saturation, but 8 wala will achieve, has got less amount of hemoglobin which is 100% saturated. So that is the reason the oxygen content will be lesser. If saturation mein agar farak hai dono mein, if this hemoglobin is unable to achieve 100% saturation, then it is a hemoglobinopathy, abnormal hemoglobins like methemoglobinemia, etc. That is what you need to understand. So that is the reason, do you have cyanosis in an anemic patient? Cyanosis kab hota hai? If the saturation got affected, you will get cyanosis. Not in an anemic guy, because in anemic guy also, like a regular guy, 100% saturation is there. But his oxygen content is lesser, because the hemoglobin content itself is lesser. That is what you need to remember. Pratik is saying, sir, please explain once more, what happens in fibrosis? Fibrosed lung is not compliant. Little lung volume, even if you apply more alveolar pressure, only little lung volume it will stretch. That is the reason the curve B was fibrotic lung, because in spite of increase in pleural pressure, the amount of the increase in the lung volume being lesser is what you need to appreciate. Now, curve A in the oxygen dissociation curve, we are bored in regularly asking you shift to right, shift to left. Instead, we are giving it in a curvaceous manner so that you will give a straight answer. So, doctor, fall of temperature, fall of carbon dioxide, alkalosis, fall of 2,3 dBg, all falls are causing the curve to shift to right. Not our right, curve's right. Curve's left, all rises. Rise to PCO2, rise to H plus, rise to 3 dBg, rise to temperature, not rise to pH, will lead to shift to right. Right is rise. What is the substance which is exchanged against the bicarbonate in the RBCs, whenever the RBC is passing through the venous blood, doctor? Chloride shift it is called as. That is the reason it is the chloride ion which is a negative ion which is exchanged against the movement of another negative ion which is bicarbonate ion is what you have to basically remember. Now you have a hierarchy of the respiratory control. In the medulla you have the respiratory rhythm generating center. Ventral and dorsal respiratory neurons are located in the medulla. What do you have in the pons? Pneumotaxic center which controls the apneustic center by inhibiting it. Apneustic center in turn will stimulate the inspiration and respiratory rhythm in the medulla. That is how the hierarchy is principal, HOD, associate professor, assistant professor and senior MD, senior postgraduate. Then doctor, in the lung if you take, you have 3 zones. Zone 1, zone 2, zone 3 if you vertically look at the lung from top to the bottom of the lung. So at the highest point, apex of the lung, called zone 1, normally zone 1 is not existent. You have pulmonary capillary pressure less than pulmonary alveolar pressure and there is no blood flow at the uppermost part of the lung. Zone 2 better be called as apex of normal lung. Anatomical apex. Capillary pressure of the pulmonary capillaries is more than the alveolar pressure. That is the reason there is an intermittent blood flow which occur only during systole. Where is the highest amount of the blood flow in the lung? Zone 3, which is the base of the lung, where the capillary pressure is more than the alveolar pressure, and in both the systole and the diastole, and that is the reason there is a high blood flow to the base of the lung. So one of the very important rule that you need to remember, whenever you take the lung, apex towards base, a very important rule is, when you go apex towards base, ventilation will be increasing. There is a more ventilation in the base. Base के नीचे क्या है? Diaphragm है. इसलिए ventilation is more in base than in apex. Perfusion कैसा है? Because of the gravity, perfusion will be higher in the base compared to that of the apex due to gravity. But the increase in the perfusion amount of increase, that is delta Q. If this is 5, this became 10. Difference कितना है? 5. But if this is 5, this has become 7. Difference कितना है? 2 only. Because the increase in the ventilation is lesser than the increase in the perfusion. Perfusion also increased, but the amount of increase of perfusion and the amount of increase of ventilation, अगर आप लिए तो, the amount of increase of ventilation is lesser than the amount of the increase that happened in the perfusion, and hence if you take V by Q ratio, it is higher in the apex. I'll give you a simple example. सोचो कि यहां वेंटिलेशन 5 है, परफ्यूशन 5 है, मगर 5 बन गया 7, 5 बन गया 10, इंक्रीज इज मोर हियर. तो यहां 5/5 कितना हो गया? 1. यहां 7/10 कितना हो गया? 0.7. सो इसलिए V by Q कहां ज्यादा है? ऊपर ज्यादा है. Favorite question of the examiner. Okay, ventilation is more in base, ventilation is more in perfusion is more in base, but ventilation by perfusion ratio is higher in apex. That is the reason amount of oxygenation which occur in the apex is higher because V by Q ratio, if it is higher, perfusion also will be higher. I mean, oxygenation is higher. Oxygen concentrations of the apex is higher than that of the base. That's the reason Mycobacterium love to live in the, not in ground floor of the apartment, but the top floor of penthouse of the apartment is what you need to basically remember.